Hey guys, it's Nurse Aleen from Go Nursing RN. Today we're going to review hemorrhagic strokes. We're going to talk a little bit about the background, some signs and symptoms, diagnostics, treatment plan, and nursing interventions. So let's begin. Alright, so let's go ahead and review what is a hemorrhagic stroke. It's usually caused by a ruptured cerebral artery or aneurysm. This results in a cerebral bleed within the brain. The prognosis can be poor if it's not caught early on due to the amount of ischemia and increase in intracranial pressure by the expanding collection of the blood. One of the biggest comorbidity of a hemorrhagic stroke is going to be uncontrolled hypertension. Another risk factor is going to be when there's a brain aneurysm that leaks or ruptures that causes bleeding into the brain, leading into a hemorrhagic stroke. Most often, a ruptured brain aneurysm occurs in the space between the brain and a thin tissue that's covering the brain. This type of hemorrhagic stroke is called a subarachnoid hemorrhage. Now, the warning signs of a stroke that is a hemorrhagic stroke and ischemic stroke is going to be the same. So in order to rule out whether it's ischemic or hemorrhagic, we want to ensure that a CT scan is going to be done without contrast to see what kind of stroke it is. Signs and symptoms are going to include weakness of one extremity, numbness, confusion, trouble speaking or understanding what the individual is trying to say, trouble seeing in one or both eyes, difficulty walking, dizziness, loss of balance and coordination, and a sudden severe headache. One of the key clinical findings is going to be the patient is going to say, I have the worst headache of my life. A lot of times that means that there is possibly a cerebral hemorrhage or even a subarachnoid hemorrhage. A lot of times these patients have heavy type of headache and pressure onto their heads and their brains. So it's really important to follow up if that's what your patient is saying. The first goal when we have a patient with a hemorrhagic bleed is to control the bleeding. With increased amount of blood and swelling in the brain, it can cause increased intracranial pressure, also known as ICP, and this can lead to a very poor prognosis. So these patients need to be in the ICU and monitored very closely. The patient may need to go into the OR and have a ventriculostomy placed to drain out the blood or the CSF and relieve the pressure from the brain tissue. This catheter will be left in place to drain everything that's causing that swelling, but it's also used to monitor the actual intracranial pressure. In addition, we can use pharmacological interventions such as 3% hypertonic solution, mannitol, and osmotic diuretics. A patient who possibly had an aneurysm as the reason to having the hemorrhagic stroke, we want to ensure that they possibly might have coiling done to ensure that that aneurysm does not leak or burst another time. We want to ensure that we're looking for any kind of neural changes after they have gone any of these procedures or treatments. We want to look to see if they have something called the Cushing's triad, which is a change in vital signs where they are going to have systolic blood pressure going up, heart rate goes down, and the patient is going to have altered respiratory pattern. We need to ensure that we protect the airway, and many of these patients who have hemorrhagic strokes will be intubated and on a ventilator. Increased intracranial pressure, and if it continues to increase, can cause compression of the brainstem and the cranial nerves, which can be very fatal and lead to herniation. Once herniation occurs, there's going to be compression onto the brainstem and cause respiratory arrest. Some key interventions for nursing when you're thinking about hemorrhagic stroke is going to be always just to make sure that we don't increase the intracranial pressure. We want to make sure that we keep the head of the bed elevated. We want to avoid suctioning or allowing the patient to put any pressure, such as having a bowel movement. We want to encourage stool softeners so they don't have to bear down, and try to encourage them if they are coughing not to cough very heavily, because again, we don't want to increase that intracranial pressure. Finally, you want to keep assessing for any neurological changes and get your physical therapy, speech therapy, and occupational therapy started early to help motivate that patient to get better. At the end of the day, control that blood pressure, and follow-up CTs are going to be key. Thank you for watching my video. Don't forget to like and subscribe here below. Also, check out my other video about ischemic strokes and stroke symptoms here shown above. See y'all next time.